I'm Christine Buman, and today I'm actually joined by athletic trainer Rusty McCune and Dr. Michael Weaver. Both of these guys are actually from our sports medicine program here at Nebraska Medicine, and that's what we're going to be chatting about today. So thank you both for taking the time to sit down and kind of talk through what makes our sports medicine program at Nebraska Medicine awesome and different.
Absolutely.
Couple of quick reminders for you guys that are watching. Please feel free to ask any questions throughout this chat. We're going to try and answer those as they come in. And also, as a disclaimer, this chat is just for informational purposes only. So if you have specific questions about your medical history or need to talk about your specific condition, please reach out to your doctor directly. So guys, we are at the Lurison Outpatient Center here off of Leavenworth Street. This is our gym. I don't know if you have anything you want to kind of talk about our facilities here.
Well, I mean, obviously the outpatient facility here at LOC is very new. It's state of the art. It incorporates our rehabilitative services here with our physical therapy and occupational therapy that we have right across the hall. You can find our orthopedic surgeons, and then there's various other services provided within the facility.
Okay, so everything's kind of centrally located and right here. So, all right, one of the things, sports medicine, right? Kids are involved in recreational. They have constant tournaments and traveling teams, and it just seems like everything's a go, go, go anymore. So with that, there's probably an influx in sports medicine related injuries. What makes, our program here so important as, kind of kids get more involved?
Well, I think that the one thing that from day one, our program goal has been to be an integrated multidisciplinary team. And so as we look at sports, not only in the youth, but across the lifespan, Nebraska Medicine, UNMC, really look to be partners within the community, and there's things that we can provide the Omaha metro area and also the state and region as well, from a multidisciplinary standpoint with specialties and services that we can provide that that others just have a hard time providing. And so I think that from that standpoint, capitalizing on the resources and the expertise that we have here really lends itself to emphasizing the importance of our team working and engaging the community and everyone that we work with and around.
Yeah, and also kind of working together as a team on each patient, right? And getting that collaborative care. So as parents are kind of getting their kids involved in sports, and as kids get more involved in sports, what are some of your suggestions regarding like coaches and the pressure that parents are getting to say, hey, they should be at the gym X amount of days a week, and it's not just for one sport but it's for two? How do you guys kind of work within those?
I'll let you pick that one.
So it's always a challenge, and I think from the sports medicine team perspective, we really communicate well through all aspects, both from the coaching staff, the athletic training staff, and then the medical staff for whoever's helping that individual athlete. Ultimately, coaches want, have the best interest of the athlete at mind, but they do want their players back on the field or court as soon as possible, and the athlete does too. But there's certain things we have to do to make sure that's safe and we don't have people facing a more devastating injury or long-term problems from an injury by doing it too quick. And so, I think that from the standpoint of the sports medicine team, just making sure that communication is always open and effective is primary. And, the coaches understand that, depending on what level of athlete you're talking about, from high school, club, collegiate, they understand the role of the medical team and are always accommodating to our requests and our advice. So
well, that's good, right?
And so I think the parents should feel comfortable about that they don't need to worry about the pressures from the team or the coach and medical staff and even other peers. They can defer them to the sports medicine team.
Yeah. But what about if their kid is, they feel like their kid's going to be lagging behind? They aren't necessarily on the court as much or any of that. What's your What's your advice there?
Well, I mean, again, it's just reassurance and education.
Yep. Okay.
You know, I think during the visits and getting to know the individual and the family throughout the course of their care and treatment, you know, providing kind of that understanding that, you know, we're going to be doing things from the rehabilitative side if they are injured to try to keep them on par with their recovery. So when they do get back there at peak performance, and not going to see that they're, you know, suffering from a conditioning standpoint or anything else. You know, so I think that that's kind of the main goal.
As an athletic trainer, do you have any concerns about kind of the workload that's being put on kids these days? And
yeah, I think you know, we obviously are seeing a number of overuse injuries, and a lot of that has to do with the specialization that's taking place. We see kids that are participating in sports year-round, and focusing only on one sport rather than doing several sports that allow them to work their different body parts in different ways, allow them to get a better balance, and really just be kids, and enjoy it for what it is, and that's being outside and being active, or being inside and being active. The other thing that we worry about is that, again, it's year-round, and then also the fact that they're being asked to do things that their bodies sometimes just aren't ready for. They're asked to do things that we see, you know, high school and collegiate and professional athletes do, and their bodies just aren't prepared for that. So those are the things that we see, that we try to identify, try to help through education opportunities like this. If we do see someone in clinic, hopefully we can catch things early. And again, use that as an opportunity to educate the parents. You know, we try to work as much as we can with teams and with athletic teams to educate the coaches, educate organizations, really to the value of rest and recovery, and the not specializing too soon, too early, and all the things that those things can lead to.
Stay kind of as a multi-sport athlete. So some of those overuse injuries you mentioned, but I mean, are injuries happening in younger athletes? Like, do the injuries kind of keep going and skewing younger? And if they do, what are some of those ones that, you know, you should look out for?
Yeah, I mean, I don't know that the rate of injuries is increasing more than it had in the past. I think the types of injuries that we're seeing, like Rusty had said, due to the one sport kind of phenomenon that's taken place, and that's probably been 10 years or so. It seems to be something that this new trend is that, hey, my kid's a baseball player, we're going to be playing baseball pretty much year-round, or practicing baseball, and same thing for basketball. And a lot of that is because we're seeing on the competitive side, once they get into high school and moving on, they feel like they need to have that background. So really it's sport specific, kind of depending on the types of injuries, if it's more of an overhead athlete or a conditioning athlete, and kind of what injuries we're seeing from that standpoint. You know, but I think that the types of injuries or the amount of injuries that we're seeing, and I don't think it's changed all that much. It's just about trying to, you know, like you said, educating them on what to do and how to train their body appropriately for their level of training.
Activity and that kind of thing. Okay. Rusty, you had mentioned seeing our team and seeing the team earlier. Is that after an injury, or is there some type of like preventative and, you know, maintenance that we typically can do with athletes? Or,
you know, I think that you know, sports medicine really encompasses hopefully preventing injuries, but also looking at treating them after they do happen. I think that from a preventative standpoint, injuries are going to happen. You know, that's part of the nature of sports. But what we want to try to avoid are those injuries that don't have to happen. And again, a lot of that comes through education. It comes through proper coaching.
One of the things that we talked about last week in our chat was sports physicals versus school physicals. You know, what's the difference, and what makes sports physicals so important for athletes?
Well, you know, so a sports physical, these are also commonly known as pre-participation examination in our world, and so PPEs for short. A lot of parents of student athletes will probably be aware of that. You know, it's really two sides. You're going to be looking at the medical history of a patient or the student, and trying to look at anything that they have, from asthma to heart problems to other conditions that might need to be managed and treated appropriately for them to participate in whatever sport they're choosing. And then the musculoskeletal side is another big component of it. So we're looking at their kind of musculoskeletal health, injury history, trying to predict things that might come up during a season, so we can hopefully again talk about preventing another injury from happening. And so it's important to look at both sides of those things, and primarily on the medical history side and the medical evaluation, looking at heart, lungs, neurological exam, things like that, so we don't have any surprises about putting someone in a dangerous situation where they could have avoided it if we found something out earlier.
Sure. Is there, do you have any suggestions of what parents should make sure to bring along, or questions, or, if they are?
So, well, I mean, I always encourage people to write down questions. If you have something, it's always better to ask than not. I think that the main things to bring along to those visits is anything you had relating to a pre-existing problem, medical condition that was being treated or is being managed, maybe with medicines or with other measures, and kind of a good knowledge of the injury history too, if they've had surgeries and how long ago that was and maybe what was done. More information is better, and I always stress that with patients and families. I always want to try to find out as much as possible, and so it's better to be overly prepared than to be underprepared. So. And certainly any questions you would have related to their participation and maybe risks that the student athlete might face playing.
Yep. So we talked a lot about student athletes, but really our programs even for athletes in their 30s and beyond, right? So you don't have to necessarily be a student athlete to see us.
Right.
Yeah, I mean, all ages, from any end of the spectrum, weekend warriors, the elderly population trying to just stay fit and healthy, to the young, even, little kids. I mean, we can manage pretty much any end of the spectrum. How
do you know when to come in and see someone on the team? Let's say there's just me, I run every once in a while, right? All of a sudden my knee hurts. How do I know? Like, do I let it go for a day or 2 or 10?
I think that some of the key things that you want to watch out for is, if you have swelling, if the area becomes red, feverish, anything that would, and things that don't go away. Obviously, if you fall and have any instability or obvious deformities, those are things that say, you probably should come in and see us. But a lot of it is knowing your body. People that are active tend to know their body. People that are just starting to get active may or may not know, and so identifying and differentiating between what is soreness and what is injury is something that they may have to get used to. And the only way to know for sure is sometimes to seek out that professional input. And so, I think anytime you have questions, if there's something that you're not sure about, that's when it's time to talk with your provider or calls, and we'll get you in to be seen. But of course, if there's any of those ongoing nagging injuries that just aren't getting better, and especially if you try to rest and then get back into your activity and it comes back, those types of things that don't get better are the things that need to be seen.
Make sure you come in and see us. Okay. So that being said, if one of our viewers today has to come in and see us, where can they do so?
We're fortunate. Again, we've given the breadth of Nebraska Medicine and all of our locations. We have access to our providers, and again, we've got our surgeons, our non-operative sports medicine physicians, physical therapy, occupational therapy. We'll have athletic trainers. You can really see us across the metro. We've got providers at Village Point, out at Oakview, here at the Midtown campus, Bellevue. So really across the metro, you can give us a call and we can get you worked in.
Across the metro for locations, but they can also see you probably along the sidelines and at various events across the town, right? And so feel free to say hi if you ever run into them. But thanks, guys. I don't think we have any questions. A couple people were saying hi to you, so you guys both must be pretty popular. So if you need... So if you guys have any questions or need any more information about our sports medicine program here at Nebraska Medicine, please feel free to visit nebraskamed.com, or to find a location or schedule an appointment with one of these guys, go ahead and call 800-922-0000.